Welcome to Bonds, the family live show right here on AGTV. This is a special episode on a topic that touches so many families, prostate cancer. Did you know that it's one of the most common cancers in men? While it's often treatable, early detection and support make a huge difference. And today, we'll be discussing how families can play a powerful role in preventing, detecting, and supporting loved ones through prostate cancer. From lifestyle tips to screening advice to practical ways to support emotional well-being, this episode is all about empowering families to take charge of prostate health together. Before we go for our first break, as usual, we'll take our scripture for the day. Today, the scripture is from Jeremiah 29, verse 11, and it says, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future." My name is Mautosade, and this is Bonds. We'll be back after this short break.
Hey there! You're watching Bonds, the family life show. Woo! A family that sticks together will always be stronger through the stormy weather. I have you, and you have me, and that's what makes us family. It's the family life show. 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 You're watching Bonds, the family life show.
You're welcome back from that break. Before we left, I mentioned that today we are talking about prostate cancer, what every family needs to know. And you're welcome once again. Remember to connect other people to the conversation. If you're watching on YouTube or on Facebook, share the link so everybody can be part. Leave your comments. Have you experienced anything of the sort, either personally or from a family member? Leave your comments, share your experiences, and leave your questions as well. You can also follow us on @myagtv. Now, to help me have the conversation today, I have with me experts in the field when it comes to medicine. First off, I have nurse. You are a medical officer, but in the nursing field, isn't it? I have Nurse Louisa Graham. You are welcome.
Thank you so much.
Can I call you Nurse Louisa then?
You can.
Okay, that's wonderful. Now, she is highly experienced and she's a registered nurse with 15 years of dedicated service, specializing in providing top quality, compassionate care. And she is a very highly educated person in the field of public health and allied sciences. She possesses extensive expertise in maternal and child health, reproductive health, effective triaging, counseling, and helping patients achieve their health goals. She's an active member of Dorcas Medical Missions and the Christian Broadcast Network's Medical Missions. Currently, she works with the Ayawasu West Municipal Health Directorate as a public health consultant for Kulan Consults. I hope I got all of that right. You are very, very much welcome.
Thank you so much.
Great to have you in the studio today.
Thank you so much.
To help me have the conversation, I have with me Dr. George Donko. Dr. George Donko is a visionary leader and an accomplished entrepreneur, renowned for his expertise in herbal medicine, healthcare innovation, and business management. Serving as the CEO and founder of Noble Trust Herbal Clinic, Dr. Donko has dedicated his career to advancing herbal healthcare solutions and promoting wellness within his community and beyond. Dr. George Donko, you are also welcome.
Thank you.
Now, it's a great thing when we're talking about health because our health is our power and that is our wealth. And for all of us, especially those who are watching from home or wherever they may be watching from, we constantly are looking for knowledge and information to help us live a quality life. Today, let's talk about prostate cancer for a minute. Before we go into the details of it, let's understand what it is. I'll start with you, Nurse Louisa. What is prostate cancer?
Prostate is It's part of the male reproductive system, and basically it's cancer of that particular organ.
Okay.
So it surrounds the urethra where the urine passes, or where we would say we wee through,
okay,
where the males wee through. So when there's cancer at that particular point, it constricts the urethra where the urine passes. So it depends on the stage and the signs and symptoms the person would exhibit. So basically it's cancer of that particular organ.
Okay, so cancer of the prostate.
Yes.
Okay. Is it anything similar to, say, breast cancer, where you would have a lump or pain or anything unusual, Dr. Donko?
So it is almost the same, in a sense that, you know, when you talk about cancer, they are a group of cells that has lost their cell functioning. So, you know, the cells has a basic function like division, multiplication, and then cell replication. Okay, so when the cells loses that functions, then they become a tumor. So the tumor becomes either malignant tumor or benign tumor. So benign tumor means that the tumor is there, but they are not harmful to any surrounding tissues. Then if it is malignant, it means that they are harmful to they themselves as well as any tissues that they will come in contact with. Okay. So when it happens within the prostate, then we will say prostate cancer. And it is almost the same as that of breast cancer. When we dive into details, we'll see they are a type of gene that causes breast cancer. The same type of gene that causes prostate cancer as well.
Wow, so there's some common underground issues going on there.
Yes.
Wow, before we get into the genetics of it all, let's talk about one very important thing. Why is it important for the family especially to know about prostate health? Okay, because we know so much about breast cancer, but we are still giving a lot of information and creating awareness because still you can't have enough of information. Why is prostate health an important issue for the family to get to know more of?
So when we talk about the family, the men are the head of the family. We can't go without the men.
Right.
And unfortunately or fortunately, most men are reluctant when it comes to health-seeking behaviors. Okay. You get the women going in for their routine checks, you get them taking their kids for their dental checks, the eye, but for men, it's one of a few. You hardly get them going in. So we would encourage that as we do our routine checks on our eye, our dental checks, our breast cancer checks, we equally go in for the prostate check. And for the family, it's an entity that can't be left out. So everybody plays a role. The dad, the mom, children plays a role. So as we are seeking for health-seeking behaviors in our various endeavors, we encourage that our fathers equally look for health-seeking behaviors and check on their health. For routine checks, we encourage at least twice in a year. If you click the year 40, you have to check. It can come in a form of anal cancer. It can come in a form of bowel movement changes. So as one person would empty the bowel maybe once a day, it will be maybe once in 2 weeks or once in 3 weeks. It is signaling the person that something is wrong somewhere, from the bowel to the rectum to the prostate. So this is it when it comes to cancer cells.
It's a crucial matter. We cannot leave it unsaid. Doc, you are the gentleman in the house today. Today, we are the majority. Yeah. but she said something very important, that when it comes to the men, they are very hesitant. They don't like to, you know, would you care to explain why men may feel that way?
Before I come to that, in every family, the continuity of the family depends on reproduction.
Right.
And in the case of male reproduction, prostate is a key ingredient that you cannot consider reproduction in men without talking about prostate. So if the prostate is sick, in fact, the continuity of a family is also having a question mark. Either it can continue or it cannot. So
it's a family matter.
It's a family matter.
It's a family matter.
So, but you know, men are one entity that they don't like visiting hospital facilities. Some with the excuses that they are very busy at work and they don't, some too are very, very restrictive in their own mind that they don't want others to know what is wrong with them. So because of self-pride, some men refuses to visit hospital for such screenings. But it has come to, I'll notice that many men are also now loving the idea that they have to check their systems, including the prostate. But this used to be before, but now
it's better.
It's
better.
better.
I personally think that it has something to do with the masculine idea of don't show weakness. And part of not showing weakness is I'm not sick, I'm always fine, so that I can show that I'm strong. We'll come to continue the conversation in a bit. We'll take our first commercial break. If you've just joined us, you are watching Bonds. We'll be back after this short break.
It's the Family Life Show.
You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for AGTV is here.
It's the Family Life Show.
This is Bonds, the Family Life Show.
You're welcome back from that break. If you've just joined us, you're watching Bonds. My name is Mauto Sade. I have with me Nurse Louisa and Dr. George here. And we are talking about prostate cancer. The family needs to be aware because Doc says it's a family affair. The continuity of your family line depends on your knowledge of how healthy your prostate may be. So welcome. Do follow us on all of our social media handles at MyAGTV and call somebody to be part of today's conversation. We are talking about the prostate, everyone. All right, so let's continue from where we left off. We talked about the men and how they don't like to visit the hospital, but Doc mentioned that it's better now than before. Which age group is more at risk, or what kind of men are more at risk of, contracting prostate cancer? Let's talk about that, and then we'll throw in some of the early signs of prostate cancer. I'll start with you.
So for the ages, we usually get majority reporting at age 40.
Okay.
But there's always exception to the rule. So some do come in there at a younger age. And then for early signs and symptoms, you get urge incontinence. So the person has the urge to empty the bowel or to urinate, but it doesn't flow as expected. And after the urge, after even urinating, the person just feels that the urge to empty the bladder more.
It's still there.
It's still there. That urge is still there. And we have that pressure. That one, the person would not have the urge, but will be dripping. So the incontinence, it flows. So the bladder tends to be emptying itself without any pain.
Wow.
Or any urge. So it depends on the stage and the signs and symptoms you would see.
Would differ.
And another thing is lifestyle. Lifestyle modification it cuts across all diseases that we talk about in public health. So issues of obesity, issues of smoking, issues of alcohol abuse, all these things come to play, and excessive use of medications, unprescribed medications. So all these things come to play, and then issues of genes, the genetics. If it runs through the family, you have to take good care of yourself. By age 20, you have to start to do your checks. Okay,
so you ventured a bit into some of the causes of prostate cancer. But let me come back to you, Doc. Let's go back a step back to talk about the risk, those who are more at risk and some of the early detection signs. She mentioned a few.
Okay, so the risk is associated with people from age 40 upwards.
Okay.
Okay, so people at that age, majority of them has exposed themselves to sexually transmitted diseases. Okay. So the male reproductive organ is from the genital to where the bladder is. The bladder is the portion of the human body where the urine stays.
Okay.
Just beneath the urine is where the prostate lies. And there is a tube that connects from the testis to the prostate, and then out it comes to the mucus. Okay. So when a man contracts STDs and does not work on that, it can cause that prostate to become inflamed.
Okay.
Over time, it will cause swelling. And then what we call the prostatitis will take place. Again, we have some men who abuses sex.
Too much sex.
Too much sex. Too less of it is not good, and too much of it is so not.
So there should be some moderation there.
Exactly, because men between the ages of 29 to 90 years produces sperms once in 3 days. So if a man abuses sex where the man can have sex about 4 to 5 times in a week, you put pressure on your prostate. So the prostate can become mushy, or what we call hyperplasia. So when you put that prostate under a microscope or the ultrasound scan, it will look rough in surface instead of being smooth. So men who abuse sex can have prostate enlargement that, when not treated, it can lead to
result in prostate cancer.
And then those who also do what we call masturbation. Some men resort to masturbation as a way to satisfy their sexual desire if they don't want to. But that can also cause the same problem as men who abuses sex. Besides this, men who are having a lot of fat in their trunk, so where you put your belt. So when that place becomes a little bit choked with fat, the fat can go around the prostate and then restrict the prostate's ability to produce a fluid like prostatic fluid and the like. That helps the prostate to work well.
Healthy. Men
who don't eat well, malnourished. So all parts of the body needs a particular hormone or minerals, trace minerals to function well. So like our bones need calcium, magnesium, silica, and vitamin D to work well. The prostate also needs zinc to work well. So if you're a man and the zinc content in your body keep reducing over time, it's like you are starving the prostate from working well. And that can cause problem to the prostate. Men who constipate, you know, where the toilet or the fecal matter stays before it comes out, we call that place sigmoid column. So men who constipate, the fecal matter can absorb through the sigmoid column into the area where the prostate is. So it tends to change the ecology of the prostate.
Oh, today I'm in the science class.
So the ecology of the prostate becomes contaminated, and that contamination affects how the prostate functions. Over time, it swells up, and then
it could also lead to
prostate cancer.
Doc, let me give you a minute to take a breath. Let me give you a minute. I mean, that's wonderful information you're giving. It seems like a lot, but I hope that those who are watching are able to follow through. What I'm getting from Dr. Donkor is that everything is interrelated. Yes. Nothing is on its own. It doesn't just come by itself. Yes. And when we're on the first break, you mentioned that we are very young people who may... Tell us a little bit about that.
Previously, the person might be getting maybe a day bowel movement. So you are able to pull for a day, but it then prolongs. Maybe 2 weeks, there's no urge for continence. Like you don't have the urge to empty the bowel.
At all.
It's there. And then multiple sexual partners. It equally gives that exposure. And then lack of vitamins, as he just said, equally falls into it. And then issues of obesity. All these
Which is
things,
what he mentioned, the fats.
all these things come to play. And when it comes to the human system, we have the cells, the tissues, and all that forming the organs. So when one cell is having an issue, it then spreads to other cells of the body. So with the cancer, for instance, there will be multiplication of these abnormal cells, and then it's attaching itself to the prostate, and then you get it being affected. So basically, that's
so just for clarity's sake, I know through the conversations we've mentioned some of the early signs, but just for clarity's sake, let's buboso. Okay, so what should someone see and run to the hospital immediately and say, I think there's something wrong with my prostate, apart from bowel movements not being regular? Yes.
All right. So, you know, in men, every man who urinates, the urine stream, how the urine comes out, must have a level of pressure.
Okay.
All right. So if you're a man and you want to urinate and the urine stream is a bit weak, meaning that where it's supposed to go or the length
how far
is supposed to go is just in front of you, you should
run
question
to the
yourself.
hospital.
Then when you urinate and you see blood, yes, there are some situations whereby blood can come, for instance, STD, so sexually transmitted disease, when there is infection in front of your bladder, you can see blood before the urine comes. And when there's infection behind the bladder, After urinating, you also see blood. But when the prostate is also sick, it can also cause you to see blood.
In the urine.
In the urine. Then, painful intercourse. After you had sex with your wife, you, the man, having pain. It's also an indication that you have to see a doctor immediately for prostate check.
To be checked.
When you see blood mix with your sperms, it can also be a sign that you have prostate problem. And some have dry ejaculation. So if you say dry ejaculation, it means that when you have sex with your wife, what should come out after
semen
should be a fluid we call sperms or semen. Some, because of the problem with the prostate is not able to produce what we call prostatic fluid, which is supposed to mix with the semen and then, or the sperms and then come out. So they will feel like they have ejaculated, but nothing came. You need to see a doctor. Then the urgency of your urination. Urgency is different from frequency. So frequency is like the number of times that you visit.
Okay.
Then when you get there, instead of like, you know, there is something that's connects with the brain in our bladder. We call it sympathetic nervous system.
Okay.
So that is when, if your bladder becomes full, it gives a signal to the brain that, look,
you need to go.
I want to go to that place. So when you enter that White House and you remove your dress, it should automatically come without being coerced.
Okay.
But when you get there and you remove your pants, and it's like you are waiting for it to come before you go.
And it's still not coming.
It's still not coming. There is a problem with the prostate. Then when you go there and then immediately you feel the urge that you have to go back to where you went, there's also a problem again.
Wow. Is there more you want to add to that, or he's covered it?
He said it all. Even with the edge, some would go with the edge, but they'll be getting the dripping factor. So like drops.
It's coming in drops instead of in stream.
Yes, you get that drops, little drops. So all that he said also counts.
Wow.
Also counts, yeah.
Wow. It's getting even more interesting here. I hope you have your pen and your notepad and you're taking notes. And I hope that you've called that brother, that fiancé, that husband, and that father. We all need to get checked, and we have to be on the lookout. If your husband is in the washroom and you hear maybe you should knock and say, please, let's go to the hospital. We'll be back after this short break. Don't go anywhere.
It's the Family Life Show.
You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for AGTV is here.
It's the Family Life Show.
This is Bonds, the Family Life Show.
You're welcome back. You're still watching Bonds here on AGTV. This is the Family Life Show. Here we talk about everything that concerns you and your family. Your health is one of those. Your health is your wealth. We are talking about prostate cancer, what the family needs to know to be able to help one another to stay bonded in love and in good health. Before we went on the break, we talked about some of the causes of prostate cancer, and we also talked about the early signs to look out for. Let's continue from there on and talk a bit about, is there anything, hereditary about it? As in, is there a family thing going on where if your dad had it, you probably will have it too, and so on and so forth? Nurse Louisa.
So I would say that if your dad have it, it doesn't necessarily mean you would get it.
Okay.
But it prompts you to modify your lifestyle. Then you seek for early medical checks. So if your dad passes on, an uncle has it, and you are a male, by 20, you should be doing your routine checks.
Okay.
You should be doing your routine checks. And just like my colleague said, any abnormality that you detect, you report. So painful urination, or you are urinating with blood. With these one, you see the blood, but it doesn't come with any pain. You have to report it. And then for obesity, issues of obesity, gaining the weight around the waistline, you have to report that too. Then for alcohol and smoking too, you have to modify it because of your exposure, because your dad has it. You have to modify it.
Is it similar to diabetes? Because it seems that one too, if it's in your family, you have to be careful how you live your life so that you may not get it. Is this a similar situation?
It's so similar. When it comes to issues of chronic diseases, Okay. It runs through the family. So you modify your lifestyle and you have a higher chances of not getting. Okay. But if you are not able to modify your lifestyle, you can get it. Some things can be changed, others can't be. Your age, you can't change it. You will definitely grow. But when you come to your eating habits, your exercises, your fruits, your veggies, your water, you can try and do as much as possible with it, and then you modify your lifestyle, and that's it.
Doc?
All right, so there is a situation where a disease can run in a family, but some family members may not get.
Spared,
right.
Yeah.
This is because majority of us learn how to cook from our family, learn how to eat from our family. So we call it genetic predisposition.
Okay.
So like your mother likes a particular type of food, and then she will teach you how to prepare that food. And maybe you like eating it in the evening. Okay. So when you marry, that is how you are going to cook
in the house.
In the house for your husband. In the near future, you may teach your children how, especially the girls, how to prepare that same food in that same way, and probably that same time. So in the morning, you eat a particular food, and then in the evening, you eat that particular food. Okay.
I get you.
If there is a disease that comes from eating that type of food, anybody who eats from that food may get it. It does not really mean that the family can get it. If somebody changes from it,
the person will be not just fine.
Okay.
Wow.
So that is one factor that contributes. And like alcohol, you know, so when you take alcohol, zinc is depleted to a certain degree. When you keep taking over time, you continue to deplete the zinc. So you thereby depriving your prostate from receiving nutrients that will help it to grow.
Right.
So if my dad used to abuse alcohol, and then he had prostate problem, and I'm also abusing alcohol,
you're also likely to have the same problem.
Exactly. But if I don't, then probably I may dodge that. So some will say, oh, some of the condition, it can skip generation. No, because of the lifestyle.
When you don't eat your food as medicine, you will eventually eat medicine as food. Yeah. As food. So let me talk a little about medicine on that note. Are there any drugs, especially that when abused, may predispose someone to getting prostate cancer? From you first.
No specific drug, I would say, but over-the-counter medications and abuse of antibiotics. Okay. And people tend to resort to all other means to treat their UTIs or the STDs. So I wouldn't mention when you take A, you will get that, or when you take B. But all these little medications that we abuse with time catch up with us, and then it dampens the system. Just like my colleague said, vitamins like vitamin B12 is very good for the brain and for the reproductive system. So when you chip in these alcohol and medications that are not prescribed, they equally dumping these vitamin B and might expose to a whole lot of cancers of those sorts. Wow. So that's what I would say about that.
You are itching to say something.
Yeah, so like any other thing that also affects the liver. Okay, so the liver is one of the seats in the body that helps us with immunity. Okay. So the liver produces one enzyme called enzyme P54. So that enzyme is like immune cells. So everybody produces cancer cells. It doesn't matter who you are. But your immune system is able to detect the cancer cells and destroy it immediately. Okay. So when your immune system is a bit weak and you tend to produce that harmful cell and you are not able to clear it from the body, it can affect how the organ system works. So specifically in the case of liver, when you tend to consume alcohol, unprescribed medication, or certain eating habit or lifestyle, it can have effect on the liver and then in turn affects how the liver is supposed to protect you and then the prostate. When you eat after 5 o'clock going.
You mean 5 p.m.?
5 p.m.
Right.
It can take up to 6 hours before it will digest. So if it does not digest, it's going to cause putrefaction, lactic acidosis, and fermentation in the body.
Those are big words, though.
Okay, so it's going to create on the indigestion food.
Thank you.
So
you have indigestion.
Indigestion.
Thank you.
It will also tend to become acidic.
Okay.
Because of indigestion. So people who tend to eat in the very late in the evening, they wake up the next morning.
Acid reflux.
With feeling more hungry than before they went to bed.
That is absolutely true. So the day when you eat heavy at night, you wake up feeling hungrier.
Yes, because another thing that you do to your body is that during the daytime, your body undergoes what you call processing mode. Okay. So your body undergoes processing mode. Then in the night, it undergoes what you call cleansing mode. So everything you have eaten during the day, the body cleanses it into your large intestine. Then in the morning, then it goes into that thing. But if you eat, now you are switching the body that, look, don't do the cleansing. Go and do processing. Then you will harm the body. And you know what happened actually is this. Just after 7 o'clock p.m., in the brain, there is something called pineal gland. That pineal gland produces a hormone called melatonin. It's a sleep hormone. Now, as soon as you start producing melatonin, it shuts your pancreas down. That pancreas don't produce any insulin to help with absorption of sugar. So when you eat,
I see the way you are smiling.
And you
like
wake up in the morning,
he's saying what you want to say.
You wake up in the morning, the sugar you ate last night, everything will be working in your bloodstream. Wow. And it will cause your body to become acidic. And our body works in alkaline terrain, meaning that the body is supposed to be alkalinic so that it can work well. Now, when it becomes acidic, disease can start to grow in our body. Yes. So basically, these are some of the lifestyle that we tend to be doing, and then it will cause disease for us.
Wow. 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 In fact, let's take a break. Let's take a break. Basically, eat early. Don't be like me. Eat early. Me, crowd will change. We'll be back after this short break.
It's the Family Life Show.
You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you busy.
Vision without action is an omission.
Raise your head high, for Reggie TV is here.
It's the Family Life Show.
This is Bonds, the Family Life Show.
You're welcome back from that break. This is Bonds here on AGTV. We are talking about prostate cancer. Before we went on the break, the simple gospel truth is eat early, preferably before 6 p.m. Your life will be a lot better if you do so. I'm not saying that's because I do. I'm saying that's because I am learning with you so we can do it together. Now, let's go back to our conversation. Genes, the idea of genetics, let's talk a bit about that. Are there any specific genes or genetic factors, you know, that increases someone's risk of prostate cancer?
So no one is born with the genes, actually, by exposure to some genes. So when it is detected early, we do the biopsy. If it's cancerous, we know that we will have to detect the extent of the damage. That's when chemo comes in, therapy equally comes in. Okay. So this is it about the genes.
So basically, nobody is born with it. No. Okay, Doc, you want to say something?
When we talk about gene, so gene is like a program, software program that controls a particular thing. So like your phone, there are software that controls it so that you can make a call, text somebody. So the genes in our body, that's the basic function. They control specific parts of the body. Okay. So in the case of, let's say, I made mention about the prostate and the breast has almost
some common grounds, yeah.
There is a gene that controls the prostate at the same time the breast. They call it BRCA gene 1 and BRCA gene 2. They are tumor suppressing gene. So when you have a tumor, this gene will suppress it.
Okay.
So when you have mutation, when you talk about mutation, let's see it as a damage to that gene. The gene will not be able to function well. So if there is a tumor, it will not suppress the tumor.
It will just allow it to grow.
To allow it to go. If a man has BRCA gene 2 and 1, a mutated one, it can cause prostate cancer. And there's another gene we call HOX B13. Okay, so it's also a type of gene. That one too, if a man possesses the abnormal version, that man can also have prostate cancer.
Okay.
And you know the prostate is just under the bladder, and beneath it is where the testicles are.
Yeah.
The testicle produces a hormone called testosterone. Now that testosterone, when a man produces, it is in a raw state. So the body has to convert that testosterone. To convert that, a man needs something called 5-alpha reductate to convert that testosterone into dihydrotestosterone before the testes will be able to work. And this is what actually helps the male reproductive organs to be able to develop. Now, when there is a problem with that conversion from 5-alpha reductate converting testosterone into dihydrotestosterone, the prostate will begin to swell up, and it will cause what we call prostate hypertrophy. And then over time, it can lead to prostate cancer. So in the case of gene, this is basically what can lead to a prostate cancer.
But I think the established fact is that no one is born with it.
Damaged ones.
Okay.
No, everybody has gene, but no one is born with damaged
ones.
Genes.
So it can only happen to you.
When you inherit.
Okay, right. Now, I mean, I think as you talk to my producers, we just need to get you a blackboard and a chalk, and then you take us to class, you know. Somehow, Dr. Donko just remembers his years doing medicine, and he's, you know. But I think it makes it easier when we understand really what we are dealing with. Let's talk about screening here. You are the ones who deal directly with the people who come in. At what age or at what point should men start getting screened?
I wouldn't set any age limit.
Okay.
So if you are 30, if you are 20, you can walk in. Previously, we're encouraging men in their 40s. But because of cases that we are getting below age 40, we encourage that all men should walk into all public health facilities, and they will be screened for that.
How
At
often?
least twice in a year, which will
Okay.
be 6-month intervals.
Okay.
So
So you just walk into any health facility
public
at all?
health facility, and we do all the screening. So for Hep B and all HIV, for breast cancer, prostate, all the others. So all these screenings are done in the public health unit in all the private and public facilities.
Right.
So the types of screening that every man can do is, one, what we call direct erector examination. So with that one, the doctor can put his hand into the anus and then feel the prostate from there. Okay. So that one is there. And then ultrasound scan of the pelvis. So with that one, if the prostate is mushy or enlarged, what we call prostate hyperplasia or prostate hypertrophy, the doctor can see.
Be able to see.
And then we have what we call PSA, prostate specific antigen. So this type of test is taken from the blood. So we take small blood sample and then you take it to the laboratory. There is a specific range that's supposed to be between 0 to 4. Okay.
So if it exceeds
if it exceeds the 4, it means that it's alarming. And with that one, some can have false reading though, in the sense that if a man manipulates his genital, let's say the man has sex, immediately and goes there to check, you may have abnormal reading because the prostate itself contains some level of PSA or prostate specific antigen. So when you manipulate, you may leak more into the bloodstream, which may give you false reading.
Okay.
So if a man wants to check that, the best thing is that you abstain from sex for minimum of 3 days.
Before
and after
you go
that,
in.
you go and then check.
But when it comes to the scan, it doesn't really matter.
It doesn't,
It doesn't really matter. Wow. Okay, now let's talk a bit. He's mentioned the PSA. So that is prostate-specific antigen. That one to any laboratory at all.
Yeah, most of the laboratories.
It's a blood test that can be done.
Please.
Are there any limitations to any of these screening methods?
So the limitation will be for people in the remote areas where hospital facilities are not
readily available.
So let's say you are living in a very far remote where blood samples we take, the reagent is not even available to test. That's when you may have limitations. But beside this, in cities like Kumasi, Accra, or any other place where there are lots of lab centers, you can go and then have it checked. Right.
I will, so to be more specific, I'm sure I didn't ask my question right. I meant for the people themselves. Let's say if you have this or you are on this medication or that, you cannot be screened, or apart from immediately after sex for that particular one, are there any other for the patient?
So when you enter the facility, you would be assessed or analyzed. So you just don't walk in and then everything goes on. There's a general practitioner who asks you some questions, or there's a tool or a guidelines. So you answer these questions, and then, as he just said, we then know when to screen you. If it is possible to be done immediately,
then
we do it.
Done.
We do it immediately. That's what we do.
Okay. Yeah. Now let's talk about the treatment options that are available. I mean, I think we've hammered everyone with the causes, with the signs, and how scary it is really when you think about it, even though it's also just another form of cancer, but we cannot take it lightly, especially like doctor says, where your family's continuity depends, you know, on it. So let's go a bit into the treatment options that are available. I'll start with you, then I'll come to you, Doc.
With treatment of cancer, we deal with radiotherapy.
Okay.
Radiotherapy and then chemo. We call it deal with chemo. So it depends on the extent of the cancer cells in the interventions.
Tell us a bit more about that.
So if it has extended from let's say the prostate to the bladder, chemo can come in. Other medications can come in. Okay. But if it's found in the early stages, it helps. In some cases there could be incisions. There will be bladder irrigations and all that. So it depends on the extent of the damage and the medical interventions to come in. Some do come in as routine checks, and it's detected at the early stage, and then modification and other medications helps with the treatment of these cancer cells. So there are cancer medications available for all these cases.
Key word there is early detection, isn't it? The earlier, the better. Doc.
The earlier, the better.
All right. So when a man is having that prostate cancer, in many cases, doctors try to stop feeding the cancer cells so that they don't grow. Okay. You know, the cancer cells in the prostate likes testosterone, that hormone. So sometimes what the doctors do is that they take off the testicles entirely so that it will not feed the prostate cancer from multiplying. Okay. So, but you know, in God's own mind, He has put in some system in our body that it works so wonderful. All right. So when the testicles is absent, there is something on top of the kidneys. We call it adrenaline. That adrenaline kicks in that, the testicle is not there to produce the testosterone. So let me produce.
So if you start producing it for it?
Yes, DHA. Then the body will convert it into compensate what the testicle is not producing.
Interesting.
Then the doctor will come in and say, okay, if that's the case, I'll give you a hormone that will stop. So another hormone to counter it. We call it estrogen therapy. But one aspect of it is this: it can cause the man to develop
female tendencies. I was going to say, because at least my signs, the little signs I know a bit about testosterone and estrogen and oh my God.
So this is also a therapy that doctors do, and some too they do complete removal of the prostate.
I was going to ask, so it's possible to just take the prostate off completely?
Take it off. But if, you know, some of this, it comes with some level of problem that some men don't really, because when it is taken from there, what happens is going to cause reversal ejaculation. So the man can ejaculate and then the sperms will go into the bladder.
Instead of coming out.
Coming out. So it will go into the bladder. But that is for the other system. But there's an alternative medicine that is also used in terms of treatment. Right. So, you know, I made mention that the testosterone is being converted into dihydrotestosterone by 5-alpha reductase. Okay. So there are some herbal preparation or medicines that when taken, it prevents the conversion of testosterone into dihydrotestosterone, which causes prostate enlargement.
Okay.
Then the underlying cause. So if, let's say, the person's own was caused by infection, infection treatment must be done so that it will not keep on causing the prostate to become inflamed and then thereby leading to cancer. And then the same infection treatment, you know, when it happens so, it's going to cause the prostate not to allow the urine to come back from the bladder. So the urine is going to cause what we call cystitis. Sometimes it can cause a bulging on the walls of the bladder. So the portion of a part of bladder will be like it has been punched, and then the urine will go and trap in there, and it will cause infection or cystitis.
Is it because of the constriction thing you mentioned? I remember at the beginning you said so it will cause some form of...
So the urethra is like, let's say, the pipeline, and the prostate is a cylindrical thing.
Okay.
So as it's inflamed or enlarged, it squeezes the line, just like what he's describing.
So the urine goes back.
Yes, some are retained, some are dripping, some don't even get the ability to come out fully.
Wow.
We'll
come back to the alternative medicine and the rest of the conversation in the bit. Don't go anywhere.
It's the Family Life Show.
You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for Reggie TV is here.
It's the Family Life Show.
This is Bonds, the Family Life Show.
Welcome back from that break. This is still Bonds. We are still talking about prostate cancer. Before the break, we've mentioned so many things when it comes to the causes and what to be careful about, especially the signs to look out for. And we've also mentioned a few things to consider when it comes to treatment options that are available. I think for me, the takeaway is as soon as you realize something may be wrong, you should quickly go to the hospital and get checked. And there is no specific hospital here. Any hospital would do, and you will get the right advice from there. Before we go, we need to talk about a few more things, especially for our young men. How can treatment for prostate cancer affect fertility and sexual health? Okay, so as always, ladies first. So I'll go with you, Nurse Louisa.
So for issues of that, what we do is, it depends on the extent.
Okay.
If there is a need to harvest the sperm and keep it in the bank for later use, we do that.
Okay.
And then if there is no need to do that, we equally do the chemo, we equally do the medications for the cancer treatment. And I know that the alternative medicine today also have their own options for that. So it depends on the extent of damage and what to do. So I would encourage that early detection really saves lives and time. Yes.
Does it affect sexual health in any way?
So in the case of doing treatment, some treatment can affect the male reproductive organ entirely. Okay. For instance, if the prostate is entirely removed, it will not be able to produce prostatic fluid, which will help with the semen to have very good sperm velocity.
Okay.
Right. And then if the testicles are also removed, you know, the testicle is actually the production house in terms of the sperm production. So if that one is going to be removed, then the man is going to probably suffer some form of impotence or permanent loss of. And sometimes the nerves around the genital area, when it's exposed to some form of radiation, it can also cause damage to the nerves, and it can also impair sexual ability. And you know, in men, their ability to gain sexual arousal is either through psychogenic or reflex. So reflex is where you apply massaging or massage it and then you gain some sensation to get up.
Okay, so if the nerves are affected,
that side will not be able to work.
All right. So, but I think I love the idea of the fact that you can harvest the sperm and it will be kept in a sperm bank just in case it affects you in such a way. Now, just for the sake of the rest of us who are not, you know, in the medical field, and I'm sure there are so many people who are struggling with all the big terms that we mentioned and how to get it. Let's very simply mention a few things. So I ask and then you give me quick answers. So first with you, Nurse Louisa, about 3 or 4 quick early signs to look out for and rush to the hospital.
So for the first sign, I would say urine incontinence. So you have the urge to wee-wee. But when you go a little drop, then you don't have the urge to push again. But you have that feeling that there is some left behind.
Okay.
That's one. Another thing I would say is you are weeing blood, like blood in urea, hematuria. So you see the urine full of blood, but you don't have any pain with that. You have to also report.
Go to the
and
hospital.
then you equally have STIs, that is prolonged.
It's not going.
It's not going. Kindly come to the hospital and be screened for that.
Thank you so much. Now, let me come to you, Dr. Donko. Quickly, what are some of the causes that people, especially our young men, should be aware of and stay clear of?
That is sexual transmitted diseases.
Okay.
And then the practices like masturbation and then prolonged sexual intercourse and frequent sexual intercourse. These things can cause problems too. And then they should also watch their diets, the food we eat. When the food lacks the nutrient the body needs, the body will begin to fall sick.
That brings me to a question that was tickling my mind a couple of minutes ago. You mentioned zinc a number of times. So can a man just decide to be taking zinc supplements just in case?
Yes, if you want to protect and then help your prostate to work well, you can help.
It's a good
But
advice.
then, you know, when you talk about health, we have certain things that are supposed to be available in our meal almost all the time.
So if you eat healthy,
you will not need to go and take specifically for the prostate.
Okay. Okay, absolutely. I get it. Now, let me go to my next question that I think everybody would want to know more about. When it comes to the family, because this is a family life show, right? When it comes to the family, how does someone, a member of the family, getting prostate cancer affect the dynamics of the family life?
So for family, it's about communication and coping.
Right.
So for the ability to bond from the initial space between mom and dad and the children, they are able to share their downs and their up moments. They're able to empathize with each other.
Okay.
So when something is detected, they're able to share. When it comes to health, it's not specifically the physical aspect, but the emotional, the psychological needs all plays a role. So for the family, whether it's happening to the dad or the son or whoever is staying with the family, there should be the need to communicate. So while we do our routine checks, we wouldn't let somebody out of the family and say, no, this one is a visitor, he shouldn't get those benefits. No. But everybody will be checked routinely at least once a year. Okay. So we are all family. We are checking mom, dad, everybody is included. And whatever the outcome is, if it's a good thing, we are building upon it. If there is a need to go for a review, we have to instill that it is done. Then we stick to our family values as Christians and be there for each other.
And be there for each other. Now, let me come to you, Dr. Donko, for a minute. Where does faith, play a role in all that we've been talking about?
Okay, so with faith, it helps the person to, one, accept the new state that the person has come into.
Okay.
Then, believing that taking medicine will help you to recover from that current situation is also important. So with marrying these two will help us to be able to live as a family unitedly without a problem.
I think the idea here is having confidence in the fact that the medicines would work and also adding prayer to it, because there is nothing we can do really successfully without praying and involving the God factor in it all. Now, let me deviate a little from all that we've been talking about. You own a herbal clinic, right? Yes. But I want to talk about, are there any herbal concoctions? You know, we are all for healthy living these days and we are mixing a lot of things and drinking. Do you know of any herbal concoctions that may put a gentleman at risk of prostate cancer?
Not yet.
Okay.
Not yet. There is no definite research done on a particular herbal medicine that can affect a man's prostate, but rather there has been some improvement or medication that when taken, it helps with a man's prostate.
Okay, okay, absolutely. Now, to you, Nurse Graham, I want to talk a bit about, are there counseling sessions or sectors available, especially in the public health sector, to help men? Because we know there are issues with health matters and there are ego problems and all of that. When it comes to prostate cancer, are there any facilities available? If there are, please share.
There is, because what we do with most of our cases, some of these diagnoses, when made, there has to be a panel to break the news to a family. A typical example is the cancers and even HIV. Okay. So there are counseling sections that doesn't come at a cost. And after these pronouncements are made, family members are enrolled onto a section that we follow up on them. Okay. So public health nurses do home visits, family visits and all that. And some would like to be counseled in a particular setting, not necessarily their homes. To be tagged that, oh, this particular nurse comes here every Monday. Why? Okay. Equally, we have people walking into the OPD services. Some would also say, no, I don't want the OPD place. I don't want this particular place, but client preferences to ensure that counseling goes down well, mentally, psychologically, and then we involve all other family members upon using their discretion.
So this is available?
Yes, it is. It is. I've worked in the Legon Hospital and we have a section for that, and there's a particular unit for that.
Wow. Thank you so very much. Don't go anywhere. We'll be back with our concluding remarks. This is Bonds, and we are still talking about prostate cancer.
It's the Family Life Show.
You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you busy.
Vision without action is an omission.
Raise your head high, for Reggie TV is here.
It's the Family Life Show.
This is Bonds, the Family Life Show.
You're welcome back from that break. It's been great having you all along. We've been talking about prostate cancer here. I've had with me two very interesting people, Dr. Donko and Nurse Graham. And we've digested the idea of prostate cancer, the causes, the effects it may have on you, your family, and also the signs to look out for. And thank you so much for sticking and staying with us. Before we leave, however, I'll take the concluding remarks of my guests who have been with us all this while. I'll give you, Dr. Donko, the opportunity to start.
You know, prostate cancer is real. It is killing a lot of people. In the world, over 1.4 million men get prostate cancer annually. And out of that, 375,000 people die annually. So, I want to urge you, men, please check. If there is a problem, see a doctor and then take necessary medical advices that they'll give you. And don't forget to pray whenever you want to take your medication. Besides this, if you also want to call me and then ask for further explanation about the discussion, you can come to my office at Dansoman near Banana Inn. Then you'll come and then we will talk more about your health.
Doc, you have a herbal clinic, don't you? What's the name of the clinic?
It's Noble Trust Herbal Center.
Okay.
So you go online, you check, you will see, you get direction to the facility.
Noble Trust Herbal Center.
Noble Trust Herbal Center. So you can call me on 0244 401929.
Okay. Thank you so much, Doc, for coming through. Dr. George Donko, it's been a pleasure having you. Next time, when I'm coming, I'll bring my calculator as well because you are a science teacher. But thank you for making time to be here with us. We are very grateful. Nurse Louisa Graham, your final words.
So I would say that, first of all, we are Christians before our work. So when our clients come in, they should trust the system. They should trust whatever we are sharing. We have doctors who would even prescribe prayer. Let's pray for this person, or let's counsel this person, or let's just follow up on such a particular person. So we should trust the system and then walk into any public health facility and our health concerns will be addressed. Thank you so much for
trust the system. Isn't that a difficult thing?
It's built.
Isn't that a difficult thing?
But
with nurses like you out there, I think that we'll be more trusting. I mean, I'm so grateful you made time to be here with us today. Thank you for sharing your wealth of knowledge with us. And thank you, everybody back at home or wherever you're watching from, for joining us for this important conversation on prostate cancer. We hope that today's discussion has given you practical ways to protect your family's health and support each other through challenges. Remember, open conversations, regular checkups, and a healthy lifestyle. I think that's the thing, isn't it? A healthy lifestyle. Cut on the smoking, cut on the alcohol, eat healthy food, and eat on time. They are all the steps you can take to reduce risks and strengthen your family's well-being. Let's continue to look out for one another. Being the head of the family, it's not necessarily to boss it around. It is to take care of yourself so you can take better care of your family as a man. Foster understanding and encourage every family member to stay proactive about their health. Take care. And until next time, let's keep making family health a priority. My name is Mauto Sade, and this has been Bonds.
A family that sticks together will always be stronger through the stormy weather. I have you and you have me, and that's what makes us family. It's the family life show. 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 Bonds, 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 bonds. It's the family life show.